Thanks for coming. My name is Jeremy Countryman. You might have seen me around because I work for the Family Cafe. I'm the program director. This is Stacy Justice. She works for a group called Axis, and they're a consultant for us on one of our grant programs. I guess I'll start off by telling you a little bit about that, because those of you who've been to Family Cafe multiple times know that usually we don't do presentations ourselves. We're usually just running the thing. But now we have a grant through SAMHSA. You guys know what SAMHSA is? Substance Abuse and Mental Health Services Administration. So it's a federal grant. It's part of the Department of Health and Human Services. So that's the division that deals with everything involving mental health and substance abuse. So we have a grant for something called a National Technical Assistance Center. And it's not tech support, even though it's got the word technical in it. What we do is essentially we are tasked with helping mental health consumer organizations, and a couple different states we're assigned to get up and running. And then we also do a lot of trainings in particular subject areas. The subject areas that we are assigned are workforce development and supported education. So this is one of the trainings we do under that grant program. This is a new one we just came up with. Normally, I would have Connie Wells here with me. Unfortunately, she couldn't make it for health reasons, so this is her daughter, Stacy, who works for Connie. And Connie and Stacy are basically kind of like a consultant that works on this grant program with us. So that's a little bit of background about what that program is. It's called the Cafe TA Center. It does have its own website if you're curious to check that out. And the last slide will have all the information about that on it. It's cafetacenter.net. So today we're going to be talking about the intersection of physical and mental health. And we're going to be going back and forth from slide to slide. But essentially, what we're going to be discussing is how these two things are related. Traditionally, the way mental health is treated and identified, and the way physical health is treated, dealt with, identified, have been somewhat separate in the medical community, separate in terms of how people approach their own individual health and wellness. So we're going to talk about how those things relate, some of the new laws that have come out in recent years that will impact something called parity, which is essentially making mental health legally equal to physical health in the way they're treated by insurance and by providers. And we're going to be identifying some of the terms, what health and wellness mean in both the mental and the physical realms and how they relate to each other. So basically, this is where we're going to start. It's where we're going to end up after going around a big circle. But one of the things that has come to light in recent years is that the relationship between physical and mental health is a deeply enmeshed relationship. Whereas it might be more traditional to think of the physical body, things that are treated physically with physical symptoms, as separate and distinct from mental health. In reality, a lot of research that's been done in recent years has demonstrated that there's a really important intrinsic relationship between these two things. And it's hard to treat one without treating the other, and it's hard to affect one without affecting the other. So obviously, if something's good for your mental health, it's good for your physical health, and vice versa. They don't really operate independently the way they're often treated.
Yeah, if you broke your leg, the doctor may not be able to see the break on it physically, but your brain is, saying you have a problem. So you have to have a brain in order to have physical problems.
This is true, yes.
Your physical health is anything that has to do with your body, such as a break, anything that has been the basis for active living campaigns, healthy eating campaigns, and all that has swept our country with the fitness for the kids and all that. The mental health one, in mental health it includes our emotional, psychological, and social well-being. And if we are not someone that has depression, say, if they're not physically active, that affects their physical and their health. But yet, and it also affects their depression. So if they're depressed, they lay in bed, they're not able to get out and exercise and so on. In the mental health, it affects how we think, feel, and act, and how we cope with life. It also determines how we handle the stress from our day-to-day lives, how we relate to others, and how we make choices within our lives and for our social and emotional being.
I think one thing that's important to point out here, this expands the definition of mental health a little bit, in that oftentimes when people talk about mental health, one of the underlying assumptions is that you're really talking about mental illness. In other words, mental health is only an issue for someone who has something like depression or bipolar disorder or schizophrenia or any other defined mental illness. But really, when you think about mental health in the larger sense, everybody has a mental health status at any given point in time. So it's not just these things that are diagnostically identifiable, that could be categorized as illnesses or disorders. As it says here, it's all the things that go through an everyday life, stress, relationships, choices, moods, that's all part of the larger mental health landscape. And thinking about it in that broader term, I think kind of makes it more relatable to physical health.
Yeah, because if someone broke their leg or something and they're used to being very active and running and getting out every day, they might not have a diagnosis of depression, but they could get depressed from having to lay around and having to rest from not being physically active. All right.
Oh, and I should have said this at the beginning, but if you want to stop and ask a question or make a statement, go for it. It's not like there's 1,000 people in here. It's going to cause I like to keep it nice and familiar. Okay, so what is health? Again, it seems like kind of an obvious question because it's one of those things you know it when you see it. It's not hard to identify subjectively, but it's a little harder to define. So it's defined by the World Health Organization as follows. Health is a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. And this is a definition that has been in existence since 1948, when the World Health Organization first came into existence. So, an old definition, but you'll notice despite the fact that it's 65 years old, so if you get Medicare, it still includes not just the mental aspect, but the social aspects as well. For those of you who don't know, the World Health Organization is part of the United Nations, essentially. So obviously they're concerned with a lot of global issues that impact health outcomes, including poverty and development in the third world and stuff like that. So that's the definition they use. Another term you hear a lot is wellness. Okay? This is one of those terms that has, for whatever reason, become quite popular recently. People just don't say get healthy, they talk about health and wellness. So we thought, hey, what is wellness? Maybe we should take a step back and consider what that actually means. So one of the things that I think is interesting about wellness is it's often more beneficial to think about it in terms of a process or a state of becoming, as opposed to something that's binary, where it's either yes or no. Either you're healthy or you're not. Your wellness is a constantly evolving state. So it's an active process of becoming aware of and making choices toward a more successful existence. This is a little smaller, but process, meaning that improvement is always possible. Now, so if things are in a process, you're not just in the state you're in and stuck there. You can change it. Awareness, obviously, is an important aspect. It means you're continuously seeking more information about how we can improve. In other words, wellness requires a degree of self-awareness and a willingness to go out, acquire more information, and alter your behavior, which leads to the next one, choices, of course. The thing about choice is it puts the power in the hand of the individual who's making the choice, obviously. So it's a somewhat empowering definition in that sense. You have control over your wellness because you have the ability to make choices. And similarly, success, you know, it says a more successful existence, and again, success is not something that you can define objectively. That's something that I think is defined in the goals and the way every individual envisions where they want to be as this process moves forward. Dang.
Wellness is different for everybody. Each individual has a different take on what it is wellness. Each doctor has a different take on how it is, what their term of wellness means. Wellness for those living with mental health challenges and substance abuse conditions it's not the absence of the disease or the illness or stress, but it's the presence and purpose of life. Being active and being actively in work and play and having good relationships and having positive things within their life that make them want to strive to make healthier choices for their physical well-being, make them want to get out in society and make them feel happy about themselves. That for a person with a mental illness, the feeling of happiness makes them feel like they're well. SAMHSA has a wellness initiative. It has 8 dimensions of wellness, and you can add to this anything you want. One of them is emotional, and that is coping effectively with life and creating satisfying relationships. And that means, and that's for anybody, not just, you know, anybody with a mental illness. It's for anybody. We want to have satisfying, happy interactions and relationships with other individuals. Environmental, good health by occupying pleasant, stimulating environments that support well-being. Financial, satisfaction with current and future financial situations, and nowadays financial, that's a stressor in everybody's life. So at some point we have a stressor there. Intellectual, recognizing creative abilities and finding ways to expand knowledge and skills. Knowing what it is you're good at. Finding ways to expand that or to create that or bring that into your life more than not. Occupational, personal satisfaction and enrichment from one's work. Being happy at work, which nowadays, you know, sometimes that's not a thing either, but being happy at work, you know, liking what you're doing, wanting to go to work, which is not always a thing. Physical, recognizing the need for physical activity, healthy food, and sleep. And that is something when any of us, I mean, sometimes we get running with our day-to-day lives and it's just so fast and we don't stop and think, well, what I did today I didn't make some very healthy choices. But, you know, that too can get with it. Social, developing a sense of connection, belonging, and well-developed support system. Have friends, family, you know, that you can talk to and connect with and be your support system when you're not feeling so, you know, good. Spiritual, expanding our sense of purpose and meaning in life, and that's with anything. So
I think if you have a lack of any one of those, then that's when you know you're not well.
yes.
Yeah.
Yes.
And this next one is sort of a Venn diagram of, you guys know what a Venn diagram is? It's basically a diagram made up of circles. So like, some people like bananas, some people like chocolate. The people that like chocolate and bananas, their circles would overlap, right? So bananas and chocolate aside, these are the 8 dimensions that we were just listing on the previous slide. And one of the things I think that is really interesting about this, just to back up for a second, this is how SAMHSA, as an agency, decided to define wellness, okay? So they're coming from the perspective of they're serving people with mental health needs and substance abuse needs primarily, okay? So notice that when you think about health in the traditional sense, you know, if you go back to when you were in high school, they make you take health class?
Yes.
Yeah, exactly. Health, they were normally just this. Whoa, this thing's sticking out. They're normally just this, just the physical, right? If the tack that's taken here the physical health is just 1/8 of the whole picture. You know, you have all these other things going. How are you doing in your job? Do you like it? Is it fulfilling? Are you spiritually fulfilled? Do you feel like you have meaning in your life? You have social relationships? Do you have enough money? How do you feel emotionally? What's going on environmentally around you in terms of what kind of environment you're in? Are you being intellectually stimulated, right? So there's a lot more going on here than just your physical health when you look at a larger picture of wellness. Now at the same time, stop and ask yourself this. When you go to the doctor, how many of these 8 things do you talk about? Right? Probably just the physical health, right? So one of the reason that we decided to make this a topic and talk about this is because I think that for, not just for people with mental illness, okay, but for people with disabilities, for pretty much anyone in the population, okay, physical health is only a little sliver of the picture of how that person's doing, right? So if we adopt this model and we're looking at all these aspects and saying, this is how we're going to decide how healthy we are, versus just going to the doctor and doing some physiological tests that are going to tell us what pill to take, we're going to have a much broader and deeper and richer understanding of what health and wellness means.
I mean, all those tried and true methods, you know, from the doctor hitting you in the knee.
Right.
Yeah.
Fine.
Right. Well, those are all great. A lot of them work,
Okay.
you know. And God knows we'd be hosed if we didn't have modern medicine here in the Western world. But at the same time,
It takes the
it's
whole
just
package.
1/8 of our whole big picture here.
Yeah.
All right. Is this me or you?
You go ahead.
Okay. So, what goes into physical health? So these are some basic things, and they're pretty familiar to most people, especially who went to the keynote this morning and heard Pam Popper.
Fantastic.
Okay. So, yes, we actually had her here 3 years ago doing the Forks Over Knives movie, which we showed for our Sunday. So a lot of these things will be somewhat familiar. Stay active. Obviously, if you're being sedentary, that's going to have a negative impact on your physical health. Now again, this is the physical health stuff. We're going to talk a little bit in a little bit about how these things cross over and affect each other from the mental and physical side. Make healthy food choices. Sleep and exercise, really important. If you're underslept, you're going to be low energy all the time. See your primary care doctor regularly. This ties into another concept we're going to get to a little bit, you know, talking about prevention, you know, doing things before the fact instead of just being reactive. Staying informed about medications. A lot of people, especially people with disabilities, have unique healthcare needs. They tend to take a number of medications. You have to make sure that you are familiar with what those medications are, their side effects. You have to make sure that your healthcare provider knows what you're taking. And if you have more than one provider, each of them should know everything you're taking because you don't want to get into any situations where there are adverse reactions from mixing things. And finally, don't smoke and avoid the use and abuse of substances. Obvious stuff you all heard, but worth reiterating nonetheless. Emotional side. Go ahead, Stacey.
Being aware of your feelings, how you feel, expressing your feelings to others, and learning coping mechanisms to overcome troubling emotions. Emotions that you might feel that you don't know are good emotions, bad emotions. If they are bad emotions, what can you do to cope with them, to handle them?
And this one, again, I find this one interesting because they're kind of listed like a bulleted list, but to me it seems like they're kind of in sequential. You know, being aware of your feelings seems on its face to be really obvious. You know, like if I'm ticked off, I know it, I'm happy, I know it. It's not something you think is really that complicated. At the same time, though, I think that everybody has to give consideration to their level of self-awareness and work on that and understand how they react emotionally to different things, why, know what's going on with yourself. One good way to do that is to be able to talk about it, right? sometimes talking through those things, you'll be talking about how you feel about something, and you'll come to a realization, you'll say, oh, all of a sudden I understand what's going on with me. I didn't know why I was mad, and I just realized by talking about it, that's because of this thing. And then once you're able to know what your feelings are, and you're able to articulate those feelings to yourself and to other people, then you can move on to learning how to develop coping mechanisms. So that's when you start to recognize the patterns in your own behavior and your own emotions, and you say, okay, I know that this thing is going to cause this emotional reaction in me, so I will go into that with a plan on how to react when that happens, right?
Yeah.
And eventually you'll get down here and you have happy face, which is way better than purple freaked out thing.
Can we do this one?
Yeah, go ahead.
Good mental health wellness. Individuals with a good mental health wellness are better able to function during stressful situations in several ways. They bounce back from adversity, and all the stressful situations we talked about earlier, could be financial, whatever. They bounce back from adversity. They're able to, like he was saying a minute ago, know that if something happens, this is how I'm going to react to it, and instead of contemplating or staying on that thought, they bounce back. They're able to go on. They communicate their feelings, like Jeremy was saying a minute ago. You know how to talk to someone or express your feelings. They forming good interpersonal relationships. If you have good relationships with other people, setting and achieving realistic goals. Set goals that realistic ones, like it says, that they can work towards and can achieve to feel good. They seek help in difficult times. And enjoy life to the fullest. And then there's self-appreciation. They're happy and glad that they could get through this and bounce back from adversity, like it says.
Where's faking it
It's in fine print.
But you know what I'm saying, a lot of people, that's...
Yeah.
Hey, well, that's part of things for sure. Sometimes, they've done studies where they found that if somebody is upset and you force them to smile, it will make them happy. Mm-hmm. So sometimes faking something can actually work because it'll sort of mentally trick you into feeling what you're faking doing. Not that I recommend going around and faking everything, but there's more to that than it being just a joke.
Yeah, because eventually you start to be like, well, okay, I'm just put a smile on my face and it'll be okay.
But again, the thing to stress about that is this is not just good mental health wellness on a given day. This is when, this important part here, during stressful situations. Okay, people who have good mental wellness are resilient to negative things happening. Mm-hmm. All these bullets that we listed here, appreciating your own quality, who you are, enjoying what's happening in the moment, being able to ask other people when you need help as opposed to just internalizing it. These are all things that are hard to do on just a normal day, but if you are able to build up strong wellness and mental health resiliency, you'll be able to do those things even in the face of adversity. Keep going? Okay.
Yeah, go ahead.
All right, so we got a little bit of a picture of, we know what goes into physical health. We talked a little bit about what goes into mental health. So this is where we're going to start putting these two things together. They're partners. One can't exist in isolation of the other. When you think about your overall health, it's imperative to include mental health to get a complete picture. Just like when you go back to that diagram we had earlier, your mental health is going to be the other 7/8 of those 8 things in your overall health. Your physical health is only going to be one part of it. Okay, when physical and mental health are out of sync. Now this is kind of, the way to think about this is, if your physical health is poor, right, then whatever mental health issues you have are going to be happening in a less resilient emotional system. So in other words, if you're not physically fit, you're going to be less emotionally resistant. Your mental health issues can be elevated. In other words, if you're not physically healthy, your mental health challenges, whatever they may be, tend to be exacerbated. They're worse than they would be otherwise. Mental health issues can become less manageable. Okay? Similarly, if your mental health is poor, then whatever physical disorders you have going on are going to be going on in a less resilient environment. Those physical disorders can become more severe, and your physical health issues can become actually more difficult to treat. Go ahead, Stacey.
Okay, in today's world, many of the fields such as medicine are starting to see the connection between the mental and the physical health. Like insurance places at workplaces are beginning to build relationships through wellness programs. I know of an insurance place that had said if this mother who has insurance through her work could get her blood levels down and lose some weight and exercise a little bit more, they'll take down her deductibles, her payments. So there's incentives. People are starting to notice, and they're given incentives for being healthy, both physically and mentally, because it is one. Yes.
Where I had worked previously, every year for open enrollment, you could reduce your payment if you, even if you're a smoker, if you took the class, you didn't have to quit smoking, you just had to take the class. And then they had other ones on how to manage cholesterol and eating. All you have to do is let's do it on the computer, and and then
They cut you
it
down.
ended up costing you less.
Yeah. So everybody's starting to notice.
Okay, so now we're going to talk about some of the things that are written into law that have altered the way physical and mental health are dealt with. And this goes into the area of parity, which essentially means that you cannot treat a mental health condition differently than you would a physical health condition. Historically, it's often been the case that it was more difficult to obtain mental health services than it was physical health services. Physical health services were more readily covered by insurance, and that is starting to be less the case now for a couple different reasons. The Affordable Care Act, which I'm sure you all heard of, aims to put in place strong consumer protections, provides new coverage options, and offers the tools necessary to make informed choices about their health. So some of that whole idea of having the multidimensional approach to health is built into the way the Affordable Care Act is supposed to work. All right, this is a wall of text, so I'll just read it to you. ACA references a variety of service issues that require discussion and recommendations regarding a set of services that should be available for individuals with mental health and addiction needs. The law will fundamentally change what services will be available to individuals that have mental health and addiction disorders. Various provisions will require benefit packages that include treatment for mental health and substance use disorder services, prescription drugs, rehabilitative, habilitative, and prevention and wellness services. These services must be available in benefit packages by fiscal year 2014. Are you guys familiar with qualified health plans? Have you heard that phrase before? You'll see it called a QHP sometimes when they're talking about the Affordable Care Act. What that means is that Health and Human Services is setting minimum requirements for what has to be covered in an insurance policy for it to be one that can be funded through the Affordable Care Act, be it through a state exchange, a federal exchange, a partner exchange. They're all going to have the same minimums, okay? So what they're saying is, essentially, they're going to require that there's benefits for mental health and substance use services, okay? Prescription drugs, that's something that's traditionally in there, not a new one. But prevention and wellness too, okay? Those are things, normally when you think of health insurance, you think it's going to be primarily covering your physical health. Because of the way this law is written, these qualified health plans that are going to be included under the law are going to be addressing the prevention, the wellness, the substance abuse, the mental health, to the same degree they're addressing the physical health. So there's now kind of like a floor in terms of what they have to offer coverage-wise. It expands access to prevention services, including annual wellness visits, right? One thing we talked about earlier was seeing a physician for a checkup regularly as a preventative measure. That's paid for under a qualified health plan. There's money in there for education campaigns. And this talks a little bit about, and some of these things have already happened in different ways in different states, but they're community prevention activities in fiscal year 2010, create additional incentives to coordinate primary care, mental health, and addiction services. In 2011, grants and Medicaid reimbursement will be available for the creation of health homes for individuals with chronic health conditions, including mental illness and substance abuse disorders. Let me ask this. Who's familiar with a health home? You guys know what that is? Okay. This is something you're probably going to be hearing, hopefully, a fair bit about. The concept behind a health home. Remember earlier I was saying if you're seeing multiple physicians, for example, you want to make sure that physician A knows what physician B gave you and vice versa, okay? What a health home is it is a single place. It's not a physical place. It's not a building, okay? It's a conceptual place where the responsibility lies for somebody's health. So, different entities could be where your health home is. Like, let's say it's your primary care physician. That person has the main responsibility for knowing what's going on with your health and wellness, okay? But the health home is not just going to be what they do in their practice. It's going to include everything. So let's say you're also seeing some kind of physical therapist, or you're also seeing some kind of psychiatrist, or you're receiving some other kind of service from some other provider. The idea behind a health home is that that lead person, okay, in the example I'm giving, the primary care physician, is going to be in charge of that home and is going to have knowledge of everything that's going on. So all of your services are being provided within the context of each other. You're not having multiple things coming from multiple places where one entity doesn't know what another's doing. The idea of the health home is if we have one patient with one entity that's their home that knows everything that's going on with them, we're going to be less apt to have services that are duplicated, and we're going to have better outcomes because we're going to have more angles covered as opposed to just having individuals treating individual symptoms or conditions.
The problem is that they're still not going to talk to each other though, right? As with my mother, she went to a urinary doctor. Her primary doctor takes her off of the medications, which is a low antibiotic forever.
Right.
And he takes her off of what the urinary doctor said, well, if you're not going to follow my advice, then,
yeah.
you know, it's nice that they're going to have it in a place, but if they're still not the doctors still aren't talking to each other.
Well, the thing about it, and this is, I'll preface this by saying this is somewhat my opinion, but it requires sort of a culture shift, and the way that medicine has worked for the last 100, 150 years is kind of the way you're describing, you know, where the doctor will say, this is what I'm doing, and they're only worried about what they're doing, and they're concentrating on sort of just the scope of what they're responsible for. This is not something that I think just happens overnight automatically. And there are a lot of things built in there with, you know, electronic health records and trying to make it easier for information to be shared between people. But this is somewhat of a different model than the traditional medical model, and it's a culture shift, and I think it'll take a while for it to really take root and for people to see the value of it and participate in it more eagerly. You know, I think there are going to be people out there who are going to say, I'm just going to worry about what I'm responsible for and that kind of thing. So yeah, I know what you're saying for sure, because that certainly does happen.
And it does kind of sound a little bit like managed healthcare.
Right, well, although managed care, that has more to, the phrase managed care has more to do with the way it's paid for.
Yeah,
But yeah,
Don't they kind of tell you?
it is managed care, the way the law is written, there's opportunities for all different kinds of places to adopt this health home model. You know, for example, because it's grant, we do a lot of stuff with adult mental health. You could have, let's say I'm a person with schizophrenia, okay? My health home could be, what do you call that place? A community mental health center,
Yeah.
where I go on a regular basis for treatment around schizophrenia. And that, because that's the main condition that I deal with, they would be sort of the lead person taking responsibility for my health, but they would still be communicating with my regular doctor, for example. Managed care companies are interested in this model because that's kind of, like you said, some of them do some of these types of things already. And the reason they do it is not because they are really nice and they think it's cool. It's because they realize that this is a more efficient way to do things, you know, because the reason, they have two motivations, right? One is to make money, the other is to have you be healthy. This model has the potential to do both relatively well because it'll be more efficient because you won't have things that are going on that are redundant, right? You won't be going to multiple people that are doing the same thing and not knowing about it. And you're also going to have a healthier person. So if you have a healthier person, they use less services, they cost less to care for, essentially. So, but yeah, managed care is
Well, the only
related to
thing about
this.
that that's scary about that is like, who has final say over their health? You know, if they come back and they go, oh, we think this is duplicated and you don't need this, like physical therapy. Oh, we
Right.
don't think you need this, but you know, when you haven't had that, you don't feel good, you know,
Right.
you need it. It's like, who's gonna have the final say over if you get it? I mean, is it gonna affect that, or would this, you still have, or it's not really sad who has final say?
well, there are a couple ways to answer that. One answer, if you can come up with more than I come up with,
Okay.
you know? I think one, I think that the individual receiving the care is responsible for that to some degree. You know, if there is a particular service that you think you need, you're going to have to advocate for that. Just like you would advocate for a service from the school in your kid's IEP, something like that. The other thing about it, and this goes back to what was on the previous couple slides, because the law is changing, there are now legal requirements for what they're going to have to do. So in other words, let's say I say, you know, I'll just go back to me being schizophrenic. You know, I'm schizophrenic and I need to see the psychiatrist every 2 weeks, and that's non-negotiable, right? Because they're now being legally required to treat mental health the same way they treat physical health. They can't say, no, you only get 10 visits a year for mental health, whereas you would get 50 a year for physical therapy or something like that. Okay.
So I would say,
That's
Yeah.
usually you find out when your insurance plan changes and then they don't want to cover
right.
X, Y, Z because either it's too close to another drug or there's another formula you want
Right.
to use.
Right.
And then it also can be the doctor fighting the insurance agency, you know, so you can get prescription.
Yeah.
It's
There's a
gonna
lot of,
be
there are,
more defined on might be.
right, there's a lot of work. Yeah.
That
Right.
happens.
So it'd
And
be easier now.
ideally, that will now happen less
Yeah.
because there'll be more things that they won't be able to say no to.
Right.
Now, there's another piece of legislation that is not gotten the amount of attention in the media that the Affordable Care Act has gotten. And that's the Mental Health Parity and Addiction Equity Act. It requires group health insurance plans that offer coverage for mental illness and substance use disorders to provide those benefits in no more restrictive way than all other medical and surgical procedures covered by the plan. Places mental health on an equal footing with physical health and works hand in hand with the ACA to promote health and wellness. So essentially, the Mental Health Parity Act, it came out a couple of years, I think it was 2008, right? And it's narrower in that it deals specifically with mental health. But this says in law that you can't do what I was just describing. You can't treat physical health and mental health differently in an insurance coverage standpoint, right? If you're going to say, we'll give you X number of visits or whatever service for this physical condition, if you have a mental health condition, they have to give you something that is equal, not identical, but proportional. They can't say, we're not doing mental health, we're not doing substance abuse. They have to do it. So, when you go to look at arguing with your insurance company or talking to your doctor or any of those kinds of things, it's good to keep that in the back of your mind and remember that that's the case. Go ahead, Stacey.
Okay, balancing towards your well-being. Like we discussed before, your well-being is your mental and your physical. Just for anybody, disability, mental health, anybody. You have to prevent it, and then be resilient, like we discussed earlier, bounce back, be adversity to stress, and then be able to recover by getting the services, talking to people, depending on others. Anything else you want to add?
No, I think just they're kind of, this is one way to look at this is sort of, before, during, and after. I don't know if you guys are familiar with the term triggers, a mental trigger. Something that, let's say you had some kind of trauma, something happens to you that brings back the experience of that trauma, those feelings, that's a trigger. It's something that sets you off. You can also think of a similar process happening with something physical, an illness, an accident, injury, okay? Prevention, that's what you do beforehand. For example, I don't smoke, or I go to my therapist every other week, or I have friends I can talk to. On both the physical and the mental side, you can do prevention. Resilience, that's your ability to bounce back when something's actually happening. How you deal with either something physically going wrong or something mentally challenging you, and then recovery is after the fact. So you have to have all three of those on both the physical and the mental side.
Prevention. Primary prevention can prevent certain mental health conditions and promote positive mental well-being for all. And again, that's in the overall picture. Prevention and can physically or mentally can make your well-being better.
Prevention strategies can be effective in preventing and reducing the severity of some mental health conditions, such as depression and post-traumatic stress disorder. Good prevention strategies can delay the onset and support treatment outcomes for those with mental health conditions. So what do we mean by prevention? Here are some examples. You probably think of some others on your own. Take care of your personal health needs and focus on well-being by participating in a regular exercise or diet planning program. In other words, if you're in good physical health, you're eating right, you'll be better able to deal with something going wrong. Seek medical help if a health problem or a stressful situation arises. On both the physical and the mental side, I think it's the sooner you deal with something, the better off you're going to be, right? I think that's something common sense we all learn. And stay tobacco free or seek help to quit smoking or using tobacco. Basically, prevention is anything you can do to get yourself ready for what you don't know is going to happen, right? So the better your health and wellness is in the beginning, the better you're going to be able to react when something happens. That brings us to resiliency. Go ahead.
Resiliency is the ability to adapt well to stress, adversity, trauma, or tragedy, and it's the ability to remain stable and maintain healthy levels of psychological and physical functioning in the face of disruption or chaos. And again, this is where we come back to your adversity when we were talking about faking it earlier, being happy, those type of things, for you to be able to bounce back in any stressful situation, illness, financially, or any of those areas we were talking about earlier. Resiliency is not a trait. that an individual does or does not possess. Instead, it has varying degrees, and each person, how they display it or handle it is differently because everybody is unique. And although some individuals are more resilient than others, resilience can be learned and developed with a little effort, and the following steps can help. Develop a positive attitude, which nowadays sometimes, I gotta get up, Be positive. Strengthen your emotional awareness. Develop an internal locus of control. Garner a social support. That'd be friends, coworkers, family. It could even be a therapist. Cultivate optimism. Be optimistic and not always down. And do not give up.
And I think the good news about this is that just like we were talking about earlier with the concept of wellness, it's something that you can do something about. It's not a yes or no. You're not like resilient or not resilient. It's something you can build. It's something you can develop. You can create strategies to make yourself more resilient. Okay, recovery. This is how it's defined in the mental health community. Mental health recovery is a journey of healing and transformation, enabling a person with a mental health problem to live a meaningful life in a community of his or her choice while striving to achieve his or her full potential. So, one thing to point out again, just like the resiliency, this is a process thing, okay? They're not saying you're either recovered or you're not recovered. Recovery is a constant state of becoming. So, in some sense, I think that's a really empowering thing, because no matter where you are in terms of your own recovery, even if you're in really bad shape, you still have the ability to say to yourself, this is where I am now, it's not where I'm always going to be.
And this
Right?
is where I want to be.
Sure, these are some of the key recovery concepts, things you need to be in recovery. Hope. People who experience mental health difficulties get well, stay well, and go on and meet their life dreams and goals. Personal responsibility. It's up to the individual, with the assistance of others, to take action and do what needs to be done to keep themselves well. Education. Learning everything possible about what is happening so that good decisions can be made about all aspects of life. Self-advocacy. Effectively reaching out to others to get what is needed, desired, and deserved to support wellness and recovery, and support. While working toward wellness is up to the individual, receiving support from others and giving support to others will help them feel better and enhance the quality of life. Again, you notice several of those concepts in there, like we were talking about earlier. It's the responsibility of the person in recovery to develop some of those things. Personal responsibility is one, learning what you can about what's going on with you and your condition, advocating for yourself. There is an onus on the individual. But to me, I think that's an empowering thing, because then you have some control over it.
And surrounding yourself with positive people in your life. Trying to surround yourself with positive thinking people to try to get you to where you want to be. Go ahead, Jerry.
Okay, so getting on board. Consider overall wellness as a critical component of mental health treatment. Research new and emerging practices to ensure the accuracy and understanding of wellness trends. Take physical health seriously. So these are some things you can do to make sure that you're looking at both sides of the coin in every situation. Now we talked a little bit about providers and whether or not they're going to buy into this. Some tips in that degree. There are many ways to bring providers into a conversation about the intersection of physical and mental health. Listen for their cues about the role each play in your overall well-being. Ask them questions about what impact mental and physical health have on one another. Gather information from national experts to share. Be prepared to find another provider that has a more holistic approach to your well-being. Again, like I was saying earlier, this can sometimes be hard to do these kinds of things. But if you could find somebody who's going to buy into the model of holistic health, that's going to recognize the importance of the physical in treating your mental health and the importance of the mental in treating your physical health, you're going to have a more holistic, more effective path toward wellness.
And like we were talking earlier, they were saying that not a lot of people are doing it. Who's going to talk to who? If we start asking these questions of them, they might start thinking, oh, that is really true. We need to start looking at the whole thing instead of waiting on them to come to us to do it. Start asking them questions.
And then just as you ask a question to your provider, you can ask similar questions to insurance companies when you have the opportunity to make decisions about who's going to be getting your coverage. Find out if they have wellness programs. In other words, they have, some people will give you a cash benefit for having a well exam once a year. Some places will pay for you to join a gym, things like that. And of course, shop, if possible, for a plan that supports wellness efforts. And one of the things that is going to be positive, going back to what we were saying earlier about the Affordable Care Act, is you should be able to find multiple options. And like I said earlier, they're all going to have that minimum basis of parity, and they're all going to have things they have to cover. Then above and beyond that, you can see what their approach is to wellness and what they'll support.
Excuse me, before you
Yep.
go on, the wellness activities and everything, I wonder if I've correctly or incorrectly heard these are some of the things that are going to be cut in the Advantage plan because of money. That's been one of the reasons to go to an Advantage Medicare plan, was because they offer the
Okay.
gym membership. My daughter and I both have WellCare. She just got informed hers wasn't going to cover the YMCA, her plan. Have you heard that this is?
Yeah, I'm not really sure about
Yeah.
that. I think that's one of those cases where if you have a benefit like that that's getting cut, you might look to see if there's another provider.
Yeah, unfortunately, they do it in February and you can't do anything until.
Right.
Right.
I mean, they did that with,
Well,
with
I
medication.
have a social security problem because anyone can write a letter to YMCA, fill out their form, and they call it a scholarship, but you list the reasons. At one time in my life, I was bankrupt and I had no money, but I needed to continue exercise. I wrote them a letter, and for like 2 years, I got the scholarship. And then, once I, was better and back at work, then I was able to pay for my own membership.
The wife's very good about that.
So I'm
but
sure
other
that she'll get,
places
if they cut the
aren't.
services up, she should be able to get it, back, because there's a lot of benefactors for those groups, and that's how they, get contributions.
Well,
But
in her case, financially, she will not qualify, but thank you for saying that.
Sharon, what were you going to say?
Because I get SSDI, my daughter gets Medicare as well, she's 28. We both are using the gym part because we have United AARP, and we've got a lot of that. The other thing, and I apologize if you talked about when I was out, but another issue for people who are mentally ill is the length of hospital stays. And I don't know if anybody read the paper today, there was something there about President Obama was addressing mental illness, and he was talking about stigma. And Pete Early, who wrote a book called Crazy, is concerned that there won't be the parity situation for people who are mentally ill and who are in the hospital, because his son was kicked out of the hospital after so many days.
Right. Yeah, I don't know if we talked a little bit about the Mental Health Parity Act, and that is an issue. And I think that's, unfortunately, and this is going to bring me to what we're going to talk about in this next slide. Some people, even mental health providers, will still disagree with the role of physical health and well-being on the mental wellness and recovery. It may take advocacy to shift and change both the system and yourself to fully reap the benefits of sound physical and mental well-being that can work together for your overall health. In terms of this advocacy piece, I wouldn't be surprised if in the next several years we saw one or more high-profile legal cases that address that exact question, because the Mental Health Parity Act, it's only been in existence for 5 years. The Affordable Care Act, although it was passed in 2010, it doesn't go into full effect until 2014. So once it does go into full effect, and there's all these requirements that mental health is treated in a manner that's equal to physical health, if there are situations where that doesn't happen, I'm sure there are going to be lawsuits. And then, unfortunately, it takes a while for the
That's how you
wheels of
test the water.
justice to turn.
Right.
But, 10 years from now, we may say, just like people say about the Olmstead decision or, the American with Disabilities Act, these people did this many years ago, and now look where we are as a result of it. So that is an issue. You know, that is an issue. And the law is on the books that mental health parity has to be there. You know, how it plays out, we'll see. But hopefully it'll be positive. Wrong direction. Okay. These are a few things that are good resources. The Prevention Institute, we talked a little bit about prevention. And to me, you know, when I was looking at the first draft of this thing, I actually asked Connie to put in that slide about some examples of prevention, because it's kind of like, you know, it's sort of hard for me to imagine all the possible things I could prevent. You know, you're looking at the unknown. It's not just like wear a helmet and put on your seatbelt. Maybe there's more things I'm not thinking of. So the Prevention Institute's a good place to get some ideas about things that can be done around prevention that'll affect the whole wellness picture, physical and mental. Mental Health Wellness Week. They have a lot of great resources on mental health wellness. And that's SAMHSA 8 Dimensions of Wellness. If you want to read more about that, there's a whole paper on it on the SAMHSA website. And a couple other things. This is a page on the SAMHSA website about parity and health reform. It gives more details about, you know, what's actually legally required in terms of parity. And then the Bazelon Center, they're a great organization. Bazelon Center for Mental Health Law, they have a ton of resources about the kind of stuff you were just talking about, Sharon. You know, what's legally required, what's the law in terms of mental health and how it's treated vis-a-vis physical health. Yeah. And I told you at the end, you're going to see contact information, so that's it. You can see this is our slightly altered special TA center Guido. He's got a Hawaiian shirt instead of just an apron. But yeah, this is the TA Center website here, tascenter.net, and that's my email and Stacy's email.
And we do have additional trainings on our various topics located on our website. Also a newsletter that we do monthly.
Yeah, monthly. There's a ton of mental health related information on here. Including stuff, in fact, last year we did a session on cross-disability collaboration between the developmental disability community and the mental health community. So you can see in a lot of the things we're doing, we're trying to sort of weave together these different advocacy groups, find out what they have in common, what things impact both groups that we can you know, help support. All right, well, it's 4 o'clock. Should we ring a bell?
I guess so.
Any
One
questions?
question.
Yeah.
This isn't exactly directly related, but it's kind of an ancillary topic. You were talking about the Affordable Care Act as far as physical insurance and recovery. There's also the Making Homes Affordable program. And one of the things I've discovered is that they won't allow medical expenses when considering whether or not someone's eligible for the assistance. And so I wanted to, if I may make the announcement that I've started a petition asking that the Making Homes Affordable Act be amended so that people with disabilities who have extraordinary mental health or physical health expenses, that those be allowable expenses when figuring whether or not they're eligible for that assistance.
What agency is making those determinations? You know?
That's an excellent question. There's a lot of little appointed agencies under the Making Homes Affordable umbrella that have been contracted to do that. Some of them are like subsidiaries of United Way. There's thousands that are subcontracted to do that. But what I found is I lost my job and I had a disability, and I applied for it. And they said because of the way the federal law is written, they could take into account my medical expenses, which are like $10,000 a year. And so my husband made too much and I didn't qualify. So
but every month it's, can we pay our mortgage this month?
Because everything's turned back into your medical.
And so I've been appealing to Marco Rubio and Bill Nelson, and I keep getting shuffled around dual pages and stuff, and I've been working on this for like a year. So I put together a petition, thinking that if I get enough signatures, maybe I'll finally get a face-to-face with the people who can make a difference, even if it's not men from Florida, to make an amendment to federal law for us. And I also threw on there, because they changed the tax returns for the medical expenses from 5% to 7.5%, that it goes back to 5%. So if anybody's interested, I can leave this here, or I actually have a table with the petitions on it downstairs in the exhibition.
In the exhibit booth?
So,
Okay.
I know where there's a website that is actually there to put petitions out to everybody,
yes, and I have it on my website.
because we've done it on limiting pain medication just because of abuse by a few people.
The website where I have my petition is on the bottom of my handwritten petition.
Oh,
Okay, cool. Thank you.
thank you.
Thank you very much.
Well, thank you for coming, everybody. We appreciate it.
Do you know if they're doing anything to